Like, I just can't think of a disease that doesn't start in the GI tract. So supporting your GI is always going to be the right choice. Whenever I think about the microbiome, I'm always thinking about the forest, right? And the trees. So the forest would be an example of like Bacteroides and Firmicutes. Those are what we used to call gram negative and gram positive. There is definitely data that shows that as we shunt towards more pathology, there will be like that Bacteroides Firmicutes ratio is not nearly as even as it should be. You know, it should be about a 1-to-1. There's different, like some slight altercations in the strains, but generally the Bacteroides and Firmicutes should be pretty equal. If you end up getting a shunt where you wipe out a whole bunch of gram negative or Bacteroides species, then that's going to cause more disease. So that's one of the patterns that we see. The other pattern that we pretty clearly see with autoimmune disease is just a lack of diversity. What we don't want in our GI is a monoculture. It doesn't work. It really doesn't work. What we want, the more diversity within the microbiome, the better. And as our diversity gets wiped out because of antibiotics or chronic stress or pesticides or fungicides or herbicides, that predisposes to monocultures getting seeded, and that causes for disease to start.